Hey there, welcome back to our channel. Today we're going to talk about a serious topic that affects millions of people around the world, cancer. But don't worry, we're going to approach it in a playful way to keep things light and informative. So grab a snack and get comfortable because we're going to dive into it. Cancer is a scary word that often comes with a lot of fear and uncertainty. However, it's important to know that cancer is not a death sentence. Early detection can save lives and increase the chances of successful treatment. That's why we want to discuss 5 warning signs of cancer that you should not ignore. We want to emphasize that it's crucial to be aware of these warning signs, as they can be the first indication of cancer. By detecting cancer early, treatment options can be more effective, and the chances of a full recovery can be significantly increased. So, let's get into it. And make sure to pay close attention because you never know when this information might come in handy. Unexplained weight loss. Have you been shedding those extra pounds without even trying? Well, you might think it's a blessing in disguise, but in reality, it could be a warning sign of cancer. Yes, you heard it right. Unexplained weight loss can be an indicator of different types of cancer, including pancreatic, stomach, and lung cancer. Losing weight without making any significant changes to your diet or exercise routine can be a cause of concern. You may initially feel happy about it, but it's important not to ignore it. The reason why cancer causes weight loss is that it can cause changes in your body's metabolism, making it hard to absorb nutrients from the food you eat. If you've lost 5% of your body weight without trying in a span of 6 months, then it's time to consult your doctor. Your doctor may ask you about your eating habits, physical activity, and other medical conditions to identify the root cause of your weight loss. They may also perform a physical exam and recommend further tests such as blood tests, X-rays, or CT scans. Pancreatic cancer is one of the leading causes of unexplained weight loss. It's a type of cancer that's difficult to diagnose at an early stage, so it's crucial to pay attention to the warning signs. Similarly, stomach cancer can also cause unexplained weight loss. It's a type of cancer that affects the cells lining the stomach and can be caused by a variety of factors such as smoking, excessive alcohol consumption, and a diet high in smoked, salted, or pickled foods. Other warning signs of stomach cancer include abdominal pain, bloating, and indigestion. Lung cancer is another type of cancer that can cause unexplained weight loss. It's usually caused by smoking or exposure to certain chemicals and can be challenging to diagnose at an early stage. Other warning signs of lung cancer include persistent coughing, chest pain, and shortness of breath. In conclusion, unexplained weight loss is not something to be taken lightly, especially if it's happening without any changes to your diet or exercise routine. Persistent cough. The second warning sign of cancer that you should not ignore is persistent coughing. We all know how annoying and uncomfortable coughs can be, but if you've been coughing for weeks or even months, it could be a sign of a more serious health issue, such as lung cancer. Now, before you start panicking, it's important to know that not all persistent coughs are a sign of cancer. However, if you're a smoker or have a history of smoking, it's even more crucial to pay attention to any persistent coughs you may have. Smoking is a leading cause of lung cancer, and if you've been a smoker for a long time, your risk of developing the disease is higher. Aside from smoking, there are other factors that could contribute to persistent coughing. For example, allergies, asthma, or even a common cold could cause a cough that could last longer than usual. However, if your cough persists for more than 3 weeks, it's time to speak to your doctor. During your visit, your doctor may perform a physical exam and order some tests such as chest X-ray, CT scan, or a biopsy to determine the cause of your cough. If the results show that you have lung cancer, don't panic. Early detection is key to successful treatment, and your doctor will work with you to develop a treatment plan that suits your needs. Abnormal bleeding. Let's talk about the third warning sign of cancer, abnormal bleeding. Now, we know that bleeding isn't exactly a topic that makes for fun conversation, but it's important to discuss it nonetheless. So let's dive into it. If you're a woman, bleeding between periods or after sex could be a warning sign of cervical or uterine cancer. This may seem scary, but keep in mind that abnormal bleeding does not necessarily mean cancer. It could also be a sign of other conditions, such as hormonal imbalances or infections. Nevertheless, it's crucial to get it checked out by a doctor to determine the underlying cause. For men, blood in the urine or stool could indicate prostate or colon cancer. Now, we understand that discussing anything related to stool might make you cringe, but it's important to remember that your health comes first. If you notice blood in your stool or urine, do not ignore it. Speak to your doctor and get it checked out. It's important to note that not all abnormal bleeding is a sign of cancer. In women, it could be due to issues such as fibroids, endometriosis, or even stress. In men, it could be due to hemorrhoids or infections. However, it's always better to err on the side of caution and seek medical advice. Persistent fatigue. Let's talk about the fourth warning sign of cancer that you should not ignore: persistent fatigue. We've all had those days where we wake up feeling tired and groggy. But if you're feeling tired all the time, even after a good night's sleep, it could be a sign of something more serious. Persistent fatigue is a common symptom of different types of cancer, including leukemia and colon cancer. Leukemia is a type of blood cancer that affects the body's ability to produce healthy blood cells, leading to fatigue and weakness. Similarly, colon cancer can cause fatigue due to the body's decreased ability to absorb nutrients. But don't panic just yet. Feeling tired can be a sign of many other conditions or factors, including stress, depression, or a lack of sleep. However, if you've been feeling constantly fatigued for an extended period of time, it's important to listen to your body and speak to your doctor. Your doctor may recommend a series of tests to determine the underlying cause of your fatigue, including blood tests, imaging tests, or even a biopsy. Depending on the results of these tests, your doctor may refer you to a specialist or recommend further treatment. Persistent pain. Let's dive a little deeper into the final warning sign: persistent pain. Pain is a part of life, but if you're experiencing pain that doesn't go away, it could be a sign of something more serious, like cancer. The type of pain you experience can vary depending on the type of cancer, but it's important to pay attention to any pain that persists. One type of cancer that can cause persistent pain is bone cancer. Bone cancer can cause a deep, persistent ache in the bones that doesn't go away with rest or pain medication. The pain may also get worse at night or during physical activity. If you're experiencing these symptoms, it's important to speak to your doctor. Another type of cancer that can cause persistent pain is ovarian cancer. Ovarian cancer can cause pelvic or abdominal pain that doesn't go away. The pain may be accompanied by bloating, indigestion, or changes in bowel habits. If you're experiencing these symptoms, it's important to speak to your doctor, especially if you have a family history of ovarian or breast cancer. It's important to remember that not all pain is cancer-related, but it's better to be safe than sorry. If you're experiencing persistent pain, speak to your doctor. They can help determine the cause of the pain and rule out any serious conditions like cancer. In conclusion, persistent pain can be a warning sign for different types of cancer, including bone and ovarian cancer. If you're experiencing pain that doesn't go away, it's important to speak to your doctor. Thanks for watching our video on the warning signs of cancer that you should not ignore. If you found this information helpful, please give us a like and subscribe to our channel for more informative content. Remember, your health is important, so if you're experiencing any of these warning signs, don't ignore them. Speak to your doctor and get the necessary tests done. Early detection can make all the difference in successfully treating cancer. We hope that this video has increased your awareness about cancer and the importance of early detection. Stay safe, take care of your health, and we'll see you in the next video.